Hello, my name is Aaron Payne. I was born in Conyers, Georgia on November 10th, 1997. I attend the Rockdale Magnet School for Science and Technology, and I am a senior, which means I'm in 12th grade, and I'm 18 years old as November 10th, 2015, and I've been diagnosed with asthma for the entirety of my life, so basically almost 18 years.
Okay, so today I'm going to ask you some questions about your asthma. The first question is, what's the biggest issues you faced having asthma?
Well, in conjunction with my asthma, I'm also allergic to dust mites, trees, grass, fur, dust, pollen. So all of those allergies compounded with asthma have really made my outside time spent really tough. And we live on a ranch style in a ranch style house with several acres of land. So cutting grass and playing on the swing set and swimming in the pool, which is located in the lower region of our house, has been very difficult, especially when the seasons change and during the pollen season. And I have really bad eyesight, so I have to wear contacts. So just compounded with that, it's hard to see. So I would really say asthma affected me most when I was trying to be active outside, and I also play a sport, baseball. So playing that sport has also made it a little bit difficult in terms of long distance sprinting, shortness of breath, and also there's some social stigma that comes with having asthma. I know that when I was a child, I had to use my inhaler, and I became kind of an outcast for that. So it was really hard to make friends as a kid because of my disease.
Okay, the next question. What allergies trigger your asthma attacks? Or what allergies have triggered your asthma attacks?
Well, like I said, when the seasons change, that's a really hot zone for my asthma to kick in. And also, as I said, I'm allergic to dust mites, trees, grass, fur, pollen. So really, around any of those things for an extended period of time, my asthma compounded with those allergies really makes it hard for me to live.
Okay, what necessary steps did you take to prevent asthma attacks?
Well, I don't know about anybody else, but how normal this is for anyone else, but I usually go and visit a allergy and asthma clinic in the Conyers area every 3 to 6 months, and they just do a regular check-in and they check to see how I'm doing with my medicine, and they change my medicine based on how I've been doing. So that's usually how I keep up with mine, and I know that I've been prescribed other medicine besides the natural inhaler, because when you have an inhaler, you have albuterol and QVAR usually, and albuterol is more of a safety, inhaler, and that's what you use once you're having an asthma attack to kind of, that's a stronger steroid than QVAR, and QVAR is basically an everyday thing that I take twice a day when I wake up and before I go to bed. But compounded with that, my doctor has also prescribed me Singulair and Zyrtec, which are just allergy medications, and I take those daily as well to help kind of suppress my allergic reactions to all of those items that I listed previously.
Okay. Have you ever or do you have an action plan for when you have an asthma attack? Do you have steps you would take to get to the hospital, breathing treatments, anything like that? Or have you ever had something like that?
In my older years, I haven't really had a lot of trouble with asthma because I've taken my medicine more regularly because I understand how the effects of asthma on me as a adult with a higher brain and IQ level. But as a child, I know that I wouldn't take my medicine as often as I should have, and I had to use things like a breathing treatment. And I know if I ran around for a long period of time that I would get shortness of breath and have to use my breathing treatment. And I didn't take as many medicines back then, so that could also be the cause of it. But now I do currently have a nebulizer or breathing treatment, and I haven't used it in several years because I just haven't had to. I keep up with my medicine pretty regularly. But if I were to have an asthma attack, I would go to my safety, which I said earlier is the albuterol. And I feel like most of the time, 99% of the time, that nips it in the bud for me at least. But I've never had to go to the hospital past when I was born for my asthma or any asthma related problems, but I have been severely sick, but that hasn't happened in a couple years. So my mother is a doctor, so usually when I have troubles with that, I turn to her for help, and based on what's happening to me, we take different courses of actions, but it's kind of a go as you, it's kind of like a go as you see type
Okay.
thing.
When you were in school, back when you were younger, did you ever have any inhalers that was given to the school just in case? Did you carry them on hand, or did you just leave them at home?
I carried my inhalers with me personally because just because as a kid it's kind of hard for adults to understand what you're asking for sometimes. So it was more of a I knew what was happening if something was happening and I could just take my medication with me.
Great having you. It was nice to have you do my interview, and I look forward to talking to you again.
Thanks.